so much blood that you are literally playing Russian roulette with your life. And then the sad thing is folks will leave there and go to a recovery house, which people are using recovery houses like they're hospitals, and they're not. In my opinion, you shouldn't be in a recovery house if you're not appropriate to technically go home and be cared for by a loved one. Recovery houses are supposed to just be adding the convenience of your loved one not having to take care of you. But it should not be replacing a hospital if that's where you belong. So I wouldn't send a person to a recovery house who is not appropriate to go home. But the problem is that they've become so popular, and it's not bad. Recovery houses aren't bad as long as the surgeon is using their judgment, their proper judgment, in who they send there. Because I've seen posts where people will be like, where a woman died, and they'll be like trying to blame the recovery house. I don't think so. That's not the recovery house's fault. If a woman lays there and dies because she had was exsanguinated by the surgeon, and the surgeon sends them to the recovery house, that's the surgeon's fault. The recovery house is not their physician. They shouldn't be there. They should have been staying overnight in the hospital. If they need blood transfusions and all this kind of stuff, they shouldn't be at no recovery house. They should be in the hospital. If I do surgery on somebody for more than 4 hours, if I have somebody asleep for 4 hours or longer, they spend the night at the hospital. I would never send them to a recovery house. They need to be monitored overnight at a hospital. Recovery houses don't have the equipment that a hospital has. They're not supposed to. A recovery house is supposed to help you get up to the bathroom. Maybe if you need your dressings reinforced, get your food and your drink, make you get up and walk, the stuff you would do at home. They shouldn't be administering medical care, having you on heart monitors and all of this kind of stuff. That's not their responsibility. Their responsibility is to take care of you like your loved one would if you went home, except they're just used to seeing the stuff, so they're not freaking out. And your loved one, you know what I'm saying? That's what it's for. It's not to replace a medical facility. It's not to replace that. So you get aggressive liposuction. They exsanguinate you. Exsanguinate means take all of your blood volume out and then send you to the recovery house. And then people wonder why folks dying. Well, that's the thing. Liposuction, when I do a tummy tuck, patients lose less blood in a tummy tuck, even though that's a much bigger operation, than they do in liposuction. Because in a tummy tuck, when you're cut open and I see something bleed, I take my electric artery and I stop the bleeding. Or if the electric artery won't stop it, I'll throw a stitch and tie off the vessel. We stop the bleeding. So there's very little blood loss that happens in a tummy tuck. I'm sorry, y'all. I told y'all I was sick. Hold on. Sorry, my throat is drying out. There's very little blood loss that occurs in operations where the person is open, where there's an incision and everything you're working on can be seen. But with liposuction, since we have these tiny incisions I was telling you about earlier, the bleeding that is started, we can't stop it because you can't see it, and so you can't stop it. So not even counting the blood that goes into the canister that we can see. So we see a third of the aspirate is blood in most people. We can see that. That doesn't even account for the blood that you're losing inside. So you know how you got all that bruising in liposuction? All the bruising that you see afterwards, that's blood. That's blood that you lost that's not in your blood vessels, meaning it can't be used for your heart to pump through your body. It's the same as the blood in the canister as far as the effects it has on your body. So you lose what you see in the canister, plus the stuff you see through your skin in the form of bruising. You've lost all that blood, and it can't be stopped. So that's why liposuction is more dangerous than some of the other surgeries you see. The third thing that plays into why we see more deaths like this with liposuction is the fat transfer piece. Because, and actually I feel like that's almost a bigger cause of some of the deaths than even the bleeding thing. And because the fat transfer causes something called fat embolism, where globules of fat, when the fat is transferred back into the buttocks, and this is fat transfer to the butt. I'm not talking about fat transfer to the breast or anywhere else. Really, this is seen majorly with fat transfer. Large volume fat transfer to the butt. But globs of fat will get inadvertently injected into the blood vessels because, this is happening blindly. There's precautions that are taken in re-injecting the fat to try to keep this from happening. But, you can't see ultimately. And so this is a risk. This is a normal risk of fat transfer to the butt. So it doesn't necessarily mean that the surgeon did something wrong. It's a normal risk of fat transfer to the butt is fat embolism. If a lot of fat is injected into a vessel, it will go to your lungs and it can kill you. And a lot of the deaths that we've seen from people who got liposuction also had fat transfer, and turned out it was a fat emboli. This is one of the reasons why I don't really care for fat transfer to the butt. That happens mostly when people get the fat injected into the muscle, more so than if it's injected above the muscle. But these are the things, this is one of the reasons why I'm kind of like, I ain't really feeling the whole fat transfer to the butt thing, and I rarely do it. And if I do it, it's not the really large ones, and I don't inject it into the muscle. So these are the things. So first, organ injury, because we're operating through these little incisions, and if the person is not a surgeon and they don't have any idea what the heck they're doing, those are the people who tend to inadvertently hit things that they aren't supposed to hit because they don't know where they are. And then exsanguination, which is too much blood loss from aggressive liposuction. And then improper monitoring after aggressive liposuction in places that they shouldn't be. If you've had large volumes of any fluid tissue removed from your body like that, you need to be in a hospital, whether it's fat or anything else. People need to be monitored appropriately, and that is on the surgeon if they are not keeping them in the hospital right after, if they know that they took a lot of fat out and blood. And then fat transfer to the butt adds a whole nother layer of risk when it comes to liposuction. Okay, so I'm gonna go back because I really wasn't looking, because when I was looking at the questions, it was throwing me off. Hold on, I need to drink a little bit, some apple juice. I'm sorry, y'all, my throat is so dry. Megan, karma. The last time somebody asked me to talk about that, the Dominican girls, the girls who send folks to the Dominican, just went off on me. Okay, here's my thing on the Dominican Republic. I have no problem with people traveling abroad for surgery if they so choose. Everybody is free to do what they want to do. But with the Dominican Republic specifically, there are really bad infections that are coming out of the Dominican Republic to the United States. And so I'm not really a fan of the Dominican Republic. I haven't heard of these things from Colombia, but the CDC issued a statement a couple times this year warning people against going to the Dominican Republic because of the really bad mycobacterium infections that people have been getting coming from the Dominican Republic that we have not been able to clear. Women being hospitalized, needing to get surgeries to try to cut out infection, on disability, like fast forward a year from their surgery and they're still fighting, trying to clear these infections. And they only have come from the Dominican Republic. So from that regard, I say be careful and do that at your own risk. But that is the warning coming out of the CDC based on the many ladies who have come back with really, really awful infections from the Dominican Republic. There are great surgeons everywhere. There are bad surgeons everywhere. There's bad surgeons in the United States. There's fake surgeons in the United States. There's bad surgeons in the Dominican Republic. There's good surgeons in the Dominican Republic. There's fake surgeons in the Dominican Republic. And it goes for every other country in between. So I don't really care where people go. I just think people should go to places where there's not regular postings of people dying, being disfigured, or put in the ICU for months at a time. You shouldn't go anywhere where those types of things are happening, whether it's the United States or anywhere else. I am not against a particular place, but I am against patterns of death and disfigurement. The aggressive lipo doesn't cause the fat embolism. It's the fat transfer that causes the fat embolism. Congregation is real. Aggressive lipo causes you to be aggressive lipo. There's other risks with aggressive lipo beyond the bleeding thing. So when you see these people talking about they got faja burns and necrosis, that also sets you up for infection. Those are all complications of aggressive lipo. There comes a point, like when I'm doing liposuction, after I've been going for a while, there will come a point in some people where I was getting beautiful golden fat back, all of a sudden it'll just be maroon. It'll just be bloody. That's my cue to stop there. Like, your body's done there. Is when it starts bleeding like crazy in an area, it's done. But with aggressive lipo, they keep going. Okay, so if I'm to the point where I'm damaging a bunch of blood vessels in that area, the blood vessels are what feed the skin. Okay, now if I go and kill all the blood vessels because I keep going when your body is telling me to stop, then your skin no longer has blood supply. That skin where all that bleeding is happening won't have blood supply because the blood is telling me that I'm killing the blood vessels underneath it. So then skin with no blood supply, any tissue with no blood supply dies. So then we go and put this compression garment on. And with a couple of blood vessels that's left gets choked off by the faja. And then they start saying the faja killed it when the faja didn't kill it. The surgeon who kept going when the stuff was telling you to stop is really what killed it. Not the garment didn't kill nothing. Now you go trying to put on a waist trainer or something right after surgery, that's a different conversation. But a normal surgical compression garment that is appropriately sized does not cause your skin to die. That don't cause your skin to die. So all of these lipo burns that we, see on these pictures and stuff like that floating around in these groups and everything, those are caused by aggressive liposuction. They're also caused by burns by the laser. If you get laser liposuction in unskilled hands, that will burn you. That will burn. I'm sorry. That will burn your skin too. But fajas don't burn people. That's crap. The faja didn't burn anybody. You don't need to hate the faja. Faja ain't did nothing to nobody. Faja is a requirement of a good result after surgery when you have liposuction. So don't hate the faja. Okay, let me go back and look at some of these questions. Okay, Godiva Chunks. Your question is one of the questions that I was going to have included on questions that will get you killed. Okay. People, this is not Burger King. You cannot have it your way. If you want a tummy tuck, going to sleep is a requirement of a real tummy tuck. Now, you'll find people say, I do your tummy tuck, but you awake. To get an adequate muscle